All right, welcome back to another installment of Live Well with UCI Health. I am Ryan Manno with iHeart Radio and KOST 103.5. Thrilled to be joined by this dapper gentleman, Dr. Graham Stephenson, board-certified medical director of urgent care here at UCI Health.
Thanks so much for having me.
And I'm sure you wear other hats, but we'll go with that as the title.
That works for me.
Fascinating backstory on that, but we'll get into that for another episode. We're going to talk about urgent cares, emergency rooms, all of this. First, let's start with, I think, probably the most common question or misconception. What is the difference?
Yeah. And, if you're thinking about that, it's probably not a good day that you're having. So It's always a really stressful moment to be there and say, where do I go? What's the right place for me to be in? So the biggest thing, it comes down to scale and scope and what you can do. So the emergency department, much bigger, much more staff, much more capability. You can come in a car, in an ambulance, in a helicopter to an emergency department. An urgent care is much more of an ambulatory center in a lot of ways, where you drive up in your car and walk in.
Okay.
Really, the simplest way to think about it is, do I think I need to stay in a hospital, or do I think that I need surgery like today? Like I have a problem that I need addressed today. Emergency department's going to be the best place for you.
Right.
A lot of other things can be addressed in the urgent care.
This might be a really strange question. Did we have urgent cares when we were kids? I don't remember ever going to I feel like it was either you went to the doctor, you went to the ER or the hospital, and that was it. Did we have them?
I think we had them, but they have become such a different thing and such sort of a necessary part of healthcare for us now.
Okay.
Just because, healthcare is really complicated, it's impacted, it's hard to get in to see your doctor. I mean, I remember my pediatrician's name and going there all the time when I had problems, fell off a bike, did something like that. And, we still have, hopefully a lot of people, great relationships with their primary doctor.
Right.
But sometimes you need to get seen kind of like right away. And that's where we fit into that gap of we're available, we're here to see you, and we're kind of here to help you right then.
Yeah. So like, I'm going to throw a couple scenarios. Let's say someone has, you're like, oh, my chest feels tight. Where do they go? Where would you recommend?
Yeah. So there are a couple things that you don't want to mess around with.
Okay. Talk to me about them.
Your heart, you don't want to mess around with your heart. So if you're feeling chest pressure, I can't catch my breath, maybe in my 50s or 60s, I started a new cycling activity program, and now I'm having a lot of chest discomfort, you got to go to the emergency department. That's not something to mess around with.
Okay.
Other things you don't want to mess around with is your head, right? Your brain. If you had a big trauma and smacked your head and passed out, that's not something that you want to take chances with. So that's an emergency department visit.
Got it.
Or especially like stroke-like symptoms. So my speech isn't what it normally is. I'm having a hard time with my hand and my leg on this side. I just can't think clearly. Those are things where for sure emergency department all the way.
All right. So let's say I'm hiking Runyon and I fall and I have a pretty considerable gash on my leg. And it's like, I'm not going to put a Band-Aid on that.
Yeah.
I need someone to look at that.
Yeah, I think that Band-Aid's not the right choice.
Right. So what is?
Yeah, I mean, the urgent care can do tons of stuff, definitely including that. So if you need stitches, if you need x-rays, maybe you broke a bone and you need to have a splint, all those kind of things we can do in the urgent care, no problem. Yeah. Much easier to get in and out of there than it would be in an emergency department.
Do people typically, do people go to the wrong place? Like, let's say cold and flu season, right? Like if you're like, oh, I think I might have the flu, I should go to the ER.
Yeah.
And now you're taking up a spot maybe from someone who's, their eye just fell out. You know what I mean?
Yeah. Well, I'll say no 2 days in the emergency department are the same. So you never know what's going to be there and what else is going to happen.
Okay.
And kind of coming back to, if you're in that position where you're thinking, where do I need to go? Like I need help and I don't know where I need to go. You're going to be stressed. You're going to be not thinking maybe as clearly as you would. So I never hold it against people if they're going to a place that might not be the right scale or scope.
Right.
So the simplest answer comes back down to, do you think that you're going to need to stay in the hospital?
Okay.
Like, I'm not going to be able to go home. This is not something I can go home with. I might need surgery today. And that can be a complicated question for patients to answer, but at least in my head, I'm thinking of, do I need to have that addressed now? Then that's an emergency department kind of a visit. Or, frequent times are you're helping a family member, right? You're helping somebody who might be older, they might be infirmed, and you don't know what to do. They can't walk. I don't know how to take care of this person and I need some help. That really, there's going to be more resources in an emergency department to help you navigate that process than what there would be in an urgent care.
Let's talk about insurance, because I feel like sometimes maybe you could get in a situation where you're like, the closest place, I don't even know if they take my insurance, but it's important to check, I'm sure. But what happens if they don't? Talk us through some of the insurance, maybe headaches.
Yeah, totally. And I mean, insurance is usually a headache. I think that's kind of the underlying thing of what's going to happen. First and foremost, if you have time, meaning that you don't feel like, hey, I'm having a life-threatening emergency right now, I think it's a good idea to check insurance at the places that you're going to go to, just to save you from having to maybe go to a secondary place or to get a bill that isn't, in line with how severe your complaint is or what's going on. So if you're thinking of going to an urgent care, 100% I would either call the urgent care or call your insurance provider and say, hey, I have this problem. I need to go somewhere close by me. Can you help kind of direct me to the right place?
Okay.
And certainly if you come to our urgent care, we help people navigate that process all the time. If you're walking in the front door, we make sure that you have the coverage that you expect to have before we'd give you care, because the last thing that we want to do is put you not only having then whatever condition or ailment you have, but then also a bill that you have to address in addition.
And you just mentioned our urgent care, so I want to make sure we get this into you guys. I know UCI Health has 6 locations.
For emergency departments, we have 6 locations.
Okay.
Yeah. Super exciting time to be part of UCI Health. I mean, we're really doing some incredible cutting edge things and expanding our footprint in a really amazing way. We have emergency departments all through Orange and part of Los Angeles County now. So Lakewood, Los Alamitos, Placentia Linda, Fountain Valley, Irvine, Orange.
Ooh, there you go. You just named them. It's like you work here. That's crazy.
Yeah.
Wow.
I mean, like I said, it's just super exciting. And I think we're really, really thrilled to see what's going to happen in the next few years as we really mature our footprint everywhere. So we're happy to care for people all over the place.
That new spot that you guys just opened up, that hospital is...
The Irvine Hospital is really, really beautiful. Yeah. And that's where our urgent care is in that same location in Irvine.
See, I'm confused. I'm doing this and I don't even... So those, you just named the the emergency room locations.
Yeah.
Now, how many urgent care locations do we have?
So we are the one and only sort of true urgent care in the UCI Health system. So we were the flagship inaugural site, which was what made it super exciting for us to launch. Because not only did we say, hey, our community really has this need. We need to have a place where people can drop in that isn't an emergency department, because you don't always need to go to an emergency department. But then also us as emergency doctors to say, what would we want? Like, what do we want this space to look like? What are the capabilities we think would be really helpful? And so that, I believe has allowed us to really launch a place that gives a great level of care with value, where we can see a lot of different people and different problems that they're having, and keeps it streamlined and yeah.
Did you just imply that you guys are consulted when they're building these things?
Definitely for our space. Yeah. They as they were building it, they said, hey, we're going to bring you guys in a year and a half before we're open. We want you to see the space. What do you guys need? What are the kind of solutions that you need to have to your problems? And I mean, frankly, what a fortunate position for us to be in, not only for us to get to work there and to manage it, but then also for the patients we get to see, right? Because then we're not trying to play catch up after we're open. We're ready to go. We're ready to see you and we're ready to give you help.
I'll think of it like this. Like if you're going to go eat and a chef's going to make dinner, I want to eat where the chef helped design the kitchen. He's going to move.
Yeah.
That's his home. He feels comfortable there.
100%.
That's where I want to see you.
Yeah.
Where you're like, oh yeah, I know all this stuff because I had input.
We don't do 3-course meals there, but I think we give you pretty good service otherwise.
That new one has like a James Beard Award already.
It's very nice. It is very nice.
It's beautiful. Let's say you're traveling. What would be your best piece of advice if you're traveling? Would you start back at the insurance route?
For me, so with my family, when I'm at home or when I'm going somewhere, I want to think about what is going to be stressful for me to deal with if I have something unexpected. So if I'm at home, I look in my neighborhood and I say, let's say my kid gets sick or I get sick, where would I go? Like, what would be the place that I would go to? And from an emergency department standpoint, by and large, they're going to be able to handle most of what you have. From an urgent care standpoint, there is way more variability of what they can do. Some places are going to be able to give you some medication. Some places are going to be able to do everything from x-ray to ultrasound like what we can do. Some places are going to have a variety of providers. And so to me, I feel a lot more reassured if I know what am I going to get when I go somewhere.
So you look ahead of time?
For sure.
Oh
yeah, for sure. So if I'm traveling somewhere, right, if I'm going to go wherever we were in, Arizona not too long ago, and I knew the town we were going to be in.
Yeah.
And, I don't know, my kid seems to get sick more often than not, right? And so I want to just know what's going on and know where to go if I have a problem.
Yeah.
So I looked and said, okay, what are the urgent cares? What are the places in the area? If I have to go somewhere, then I'm not dealing with my family, new unfamiliar place, all those kind of things, and then trying to figure that part of the process out. So to get back to kind of the root of your question, insurance can really help with that, to say what's covered, where can I go that's going to be covered underneath my umbrella so that my bill is approachable. But I also want to know, what can those places do? Because if, I fall or my kid falls and their ankles turned the wrong way, then if I go to a place that doesn't have x-rays, they're probably not going to be able to help me out too much.
Yeah. And this is why we're grateful for what you guys do here at UCI Health. There's a quick, as you're sharing that story, it just reminded me of Ellen Kay, my co-host on KOST 103.5. They were in Greece and her husband was on a scooter and he hit the gas when he shouldn't have and he rammed into a wall and he split his head open. And they needed emergency care. And she tells me the guy just was like, I'll stitch it up. And he was smoking a cigar while he was doing it. He threw him on a table and, it's like, thank God for you guys.
Well, sometimes you take the care that you can get depending on where you are.
I guess. Go ahead.
Yeah.
Could you put the cigar out?
Times have changed a little bit, I'll say. Yeah, we're a no smoking campus.
Yeah. And let's talk about times changing, because I've thankfully never, maybe once or twice had to go to either an urgent care or an ER. But I do remember, and this is years and years ago, I do remember it being boring, cold, and I don't necessarily mean it was it just wasn't. It didn't feel good to be in there, right? Yeah, and you're there for a long time. So, what things would you recommend people bring if they know they're coming in for maybe a long stretch in a spot like that?
Yeah.
And I'm not saying yours are. I'm saying the beauty and niceness that you guys now operate.
Yeah, and like I said, no 2 days in the emergency department are the same, so you really don't know what you're going to get. And maybe first and foremost is just bringing an open mind, understanding that no matter what kind of issue that you're having, we're having ambulances, all these things come in with people that need help. We do not want to make you wait or make you uncomfortable, but we're oftentimes doing the best we can with the resources that we have. So having a little bit of understanding that it's a complicated, dynamic kind of a place is one of the biggest things. From a more practical sense, I would say phone charger helps a lot, especially if you wind up needing to call your family or you need help with something and then your phone is dead. Most people don't have all those phone numbers memorized these days anymore. So that's a big one that's helpful to bring. Outside of that, sometimes something to do, a good book, cozy up in the corner, and be able to charge your phone up and those things, that can go a long way. Yeah. But most of all, I think just understanding that we're going to try and get you where you need to go as quickly as we can. And hopefully that's home. And if it's not, we'll get you into the hospital. Yeah.
We'll wrap on this final thing here. What would you say, because I'm sure you're well-versed in all of the urgent care world, ER world, what would you say, sets UCI Health apart from anyone else?
Yeah, I'm super proud of the care that we deliver and the structure that we've made for us. The biggest things I would say in our urgent care particularly is we always have a board certified emergency physician who's there. I think that's a huge, huge benefit to us. We have a lot of capabilities with imaging, so X-ray and ultrasound. We have both point of care and formal ultrasound.
That's important. Both of these things are very important.
Yeah. We can do tons of stuff with that.
I love that.
And so we can really get a lot of answers really quick there at the bedside or just right around the corner. And so that I think is really, really amazing. And to go back to a second to the having a certified emergency doctor there all the time, why I think that's so important is because we can treat a lot of different things. If we have the expertise to help you in the emergency department, we have the expertise to help you in the urgent care. But also, if we're giving you the advice, I think you need to go to the emergency department, we're doing that because we know what's there and what you can get there. This isn't sort of a blind recommendation of, I think that you got to go somewhere. This is complicated. We're coming at it from, this is our zone. This is our area that we operate in. And I want you to get somewhere that you can get the care that you need.
That's fascinating. Would anyone ever push back on that advice? If you're telling them?
Yeah. So
I would listen to you. Yes, sir. I'm on. Yes, I'm going. I would not argue with you.
Well, it's not prescriptive. It's always us saying we want to make sure that you're safe and that you're healthy. Yeah. And a lot of times people have been to the emergency departments and it's been an emotional or a challenging experience, maybe for themselves or for a family member that they were there with, and they don't want to go back there. And I totally understand that. And I hope that people know when they're coming into the urgent care and we say, hey, we think you need to go to the emergency department. it's for a good reason, because I work there all the time. So I know how hectic that place is and what they can do there. So if I'm saying that that's the only place that you're going to get better, I really mean it. And I hope that I can do whatever I can to make that transition more comfortable for you.
Yeah. And I said we were going to wrap, but now I'm more curious. What's the most common thing that you tend to see, or like 1 or 2 or 3 things? What are the top things that people come in for?
Yeah, I mean, it definitely different in the emergency department versus in the urgent care. I would say now we're lucky in Southern California with the sun being out, a lot of new bike accidents. I tripped and now I don't know if I have a broken bone.
Yeah.
There's been a lot of flu and COVID and colds that have been going around. So a lot of people just not feeling well, needing a little bit of help. And a lot of little ones have been coming in with some wheezing and some coughing. And so really nice for us to be able to do breathing treatments and other things in the urgent care to help them getting better. Emergency department, at least for us in Orange here, we're a big trauma center. So a lot of car accidents, so a lot of people who are dealing with complicated chronic conditions, if they have cancer, if they have immunosuppression for some reason or another, we help people with really pretty serious problems that are there. So we're happy to help people and glad that we have the resources that we do, for sure.
And what a range, from a little kid with wheezing to a car accident. I mean, that's
welcome to emergency medicine. Yeah, that's what we do.
Is that like, do you go to work just die, like keyed up? Because I would be like, my stress level, I got a new Oura ring. This thing would be like, bro, you need to go lay down.
Yeah. Well, I stopped wearing my Oura ring because I think it was saying, you're having a problem today. And I'm like, this is a Tuesday, so dog? That's not so good. Yeah. I mean, when I looked at it, I said, I want to be a doctor where if something happens in the world, right? Like if I'm in a parking lot, if I'm in an airplane, if I'm in wherever, I want to be able to look at that and say, I know what to do. And I'm the right person to be here to do that. And that's what emergency medicine is, no matter where you are, no matter how serious it is, you know what to do about it. And so hopefully that's how I feel when I'm at work every day too. No matter what you're coming in there with, I know what to deal with and know what to do about it.
And I think too, as a patient, right, that, you don't want to see their doctor like sweating or stressing, right? I mean, there's nothing like somebody like you, doctor, going, I know how to treat you. I know what to do. Yeah. That's awesome.
Well, we certainly share in the stress that patients feel when they're coming in with something super serious. And, that's a daily interaction that we have with people, and giving people space to be afraid, I think, is really important, because these things are not normal. It's maybe the one and only time in your life that you're going to be experiencing something like that. So it's really, I think, powerful for us to get to share that moment with people. But it's also important for us to kind of keep, a firm head on our shoulders and say with confidence, we're going to take care of you.
I love that. They're going to take care of you. And that's what they do. UCI Health, it's Live Well. Dr. Stephenson, thank you so much. And thank you for all you do for the community.
Yeah, thanks for having me.
He's running it.